गाड़ करूँ, चल खुद ही चला जाऊंगा। उसमें भेजने की क्या जरूरत है। चलो दिलीप जी स्टार्ट करें। यस एग्जैक्टली, गोल्ड मैन ऑफ एफएमजी। चलो, a patient with a three hypopigmented anesthetic pads with a one thickened nerve presents to your OPD. What shall be your treatment? You already know possibacillary multi. We have already discussed. So let's write it down. Okay. Now, my classical question to you guys. Let me see who will answer from the pharmacology. You have a patient coming to you with the diagnosis of a leprosy. You gave a treatment, clofazimine, dapsone, and rifampicin. Now, patient is resistant to rifampicin. What is the drug you will give? Online people, am I audible? बेडाक्विलिन टीबी में क्यों जाता है? ये कौन गया बेडाक्विलिन? रिफापेंटिन, रिफाब्यूटिन, दे आर ऑल डेरिवेटिव्स ऑफ रिफेम्पिसिन ओनली। तो कोई फायदा नहीं है ड्रग चेंज करने का, ठीक है ना? रिफामेंटिन, ब्यूटिन, रिफामेक्सिन, वो सारे रिफेम्पिसिन के डेरिवेटिव है। सो यू हैव अ पेशेंट coming to you. You have a patient coming to you. You have a patient having a resistance of which drug? Rifampicin. In case of which? Leprosy. Now, what is the leprosy resistant treatment? पढ़ा है कहीं? कहीं पढ़ा नहीं है। Rifampicin resistance, if resistance to rifampicin, sir, the drug we use is clarithromycin or minocycline. Clarithromycin or minocycline. Now, my dear students, tell me what is the side effect of minocycline? This was a NEET PG recall question. What is the side effect of minocycline? Hyperpigmentation. Write it down. Hyperpigmentation. See, all the recall questions I'm trying to tell you here only so that it will be easy. ठीक है? Hyperpigmentation. ठीक है? Now, sir, this is a case of which leprosy? Paucibacillary leprosy. Number of skin lesions in pauci? 1 to 5. Multi? More than 5. What are the drugs? Dapsone, rifampicin, clofazimine. और यहाँ पे भी सेम ट्रीटमेंट. ड्यूरेशन ऑफ ट्रीटमेंट यहाँ पे 12 months. Follow up yearly for how many years? 2 years. Here yearly for 5 years. Is that clear? Is that clear? चलो सर, अगर आरजीसी क्लासिफिकेशन के हिसाब से विल क्लासिफाई देम, सो टीटी एंड बीटी विल कम अंडर paucibacillary, and borderline leprosy and lepromatous leprosy will come under this condition. ठीक है ना? Most common nerve injured, अल्ना नर्व, हर जगह अल्ना वे दिखती है. फॉर एनेस्थीसिया, डेप्थ ऑफ एनेस्थीसिया कौन सी नर्व? अल्ना नर्व. मोस्ट कॉमन क्रेनियल नर्व, दैट इज गोइंग टू बी फेशियल नर्व. दैट्स गोइंग टू बी फेशियल नर्व. इज दैट क्लियर? हो गया? चलो बता दो. टाइप 1 लेप्रा रिएक्शन, यू हैव अ रूल ऑफ 5, तो कौन सी हाइपर सेंसिटिविटी होगी? 4. टाइप 2 हाइपर सेंसिटिविटी 3. इज दैट क्लियर बच्चों? यस सर. व्हाट इज द ड्रग यूज फॉर लेप्रा रिएक्शन? थैलिडोमाइड. और इसको क्या बोलते हैं? रूल ऑफ 5. क्लियर हो गया? डन. नेक्स्ट. थैलिडोमाइड फोकोमिलिया कराता है. दिस was a national leprosy elimination program launched in 2005. This is a Sapna campaign mascot for a leprosy, and this is a logo for National Elimination, NTP, National Tuberculosis Elimination Program, NTEP. इनका गोल क्या था? हम कब तक करेंगे एलिमिनेट? 2025. But a sustainable goal development, as per them, they will eliminate the TB by 2030. Sustainable goal development, SGD के हिसाब से. Is that clear? There is a new update in the tuberculosis where update is BPAL-M regime, where M stands for moxifloxacin. I'm expecting this might come. Okay, and incentives. Okay, as per the dots. Okay, now 1,000 rupees per month. ठीक है? Beta coiling. Okay, let me show you PSM. This is PSM. Okay, see, before the new regime was which regime, guys? B PAL M regime. Okay, but now the update is B PAL M. M is moxifloxacin. Now, IT based software for TBs, Nikshay, and Nischay for urine pregnancy kit, and Nikusht for leprosy. ठीक है ना? इन तीनों को याद रखना. Nikshay, Nikusht and Nischay. चलो, तो टीबी हो गया. Now this. Tell me the answer. One of the methods of health communication where 4 to 8 persons are qualified to talk about the topic and discuss a given program problem. Yes, what is your answer? Very wrong. What is the answer? If they are in sequence, simple. If they are not in the sequence, panel discussion. Now let's discuss about a different types of communication. Either there is one way or two way. Are you getting my point? One way communication or two way. Didactic or Socratic. Okay, na? Now if we talk about main important types of communication where they where they ask a question. First of all, it's going to be focus group discussion. Now, what is this focus group discussion? This is discussion among 6 to 12%. This discussion among 6 to 12%. There is one group leader. Okay. There is one recorder and it's a two-way process. And that's going to be two-way process. If I talk about a panel discussion, again, same. कितने लोग होंगे? 4 to 8 experts. Okay. But is there any correct order of speech? No, sir. TV channels. पहला बोल रहा होता है अचानक से somebody else, third person. Your grandfather was a robber. वो आ जाता है. लड़ाई हो जाती है. That is called as panel discussion. But if somebody is first turn, second turn, third turn, and they give their views, that is called as symposium. Is that clear? If one on one, that's called as interpersonal communication. Okay? If I'm demonstrating something, that's called as demonstration. Is that if I'm having a series of photographs and I'm telling you step number one, step number two, I'm communicating something with the help of series of photographs. That is flannel graph. If you have to break the bad news, that is a spikes technique. This is all about what? Ways of learning or ways of communicating. Chalo, likh do ab panel discussion. In panel discussion, it's discussion among, that's going to be discussion among 4 to 8 experts. Discussion among 4 to 8 experts. Then example, news channels. And remember, there is no specific order of speech. There is no specific order of speech. Okay? Chalo. Next is going to be symposium. Next is going to be symposium. What is symposium? Discussion among 4 to 8 experts in front of audience. ठीक है ना? Then this is a which process? Two-way process. Okay, and there is specific order of speech. This question was asked years back. Okay, panel discussion and symposium. Panel discussion and symposium. Okay, Then demonstration. We have a principle in demonstration. What is that? Seeing is believing, learning by doing. Which condition? ORS. Or workshops, sorry, not workshops, or the when we demonstrate about the how to use the sanitary pads. Okay, that's also a what? Demonstration. So what is the principle? Simple question was asked. Seeing is believing, learning by doing. Is for which type of communication? Demonstration. Learning by doing. For example, ORS. Spikes technique. In order to break the bad news, the technique we use, Spikes technique. Set up the interview, perception, invite, knowledge, emotion, and strategy. Okay, this is the protocol of 6 steps. Okay, set up an interview, perception, invite, knowledge, explain, and emotion and strategy. Okay, so if somebody is having any disease, okay, so you have to tell them that you're suffering from the lung cancer. So you need to safety, you need to give him a knowledge, you need to summarize and tell the things step by step. Okay, we have a one more approach for the contraception counseling called as cafeteria approach, or which technique? Gather, greet, ask, tell, help, advise. ठीक है ना? And return. ठीक है? Which for contraceptive counseling, which approach? Cafeteria approach. ठीक है? Best among all is IPC, one on one, which interpersonal communication, followed by focus group discussion. ठीक है? चलो बता दो. Very good. What is the answer? What is the answer? Weight for height. All the online people out there. What is the answer? Weight for height. So now decrease weight for age. That is seen in underweight or acute plus chronic. Acute plus chronic undernutrition. Low weight for height. That is going to be seen in acute malnutrition, called as also acute malnutrition. Wasting. Then decrease height for age. Chronic malnutrition. और उसमें क्या आएगा? Stunting. That is going to be stunting. Is that clear? Is that now? If we talk about the main differences between Kwashiorkor and marasmus that they usually ask, if we talk about Kwashiorkor, it is developed. It's seen in the children whose diet is deficient of protein, but marasmus में proteins plus calories. ठीक है ना? It occurs at the age of 3 years, 6 months to 3 years. It's seen in infants under which year? 1 year. Subcutaneous fat is preserved, but here subcutaneous fat is not preserved, due to which you will see prominent ribs. But वहां पे there is no scene of prominent ribs. Edema, hepatomegaly, splenomegaly, or edema is present in Kwashiorkor. Over there, there is no edema present. Fatty liver, enlarged fatty liver is seen in, and there is no fatty liver in marasmus. Ribs are not very prominent. Ribs are, it's lethargic, is alert and irritable. Muscle wasting, very mild, but here severe muscle wasting. No appetite at all, but here voracious feeder. The person suffering from a Kwashiorkor needs an adequate amount of protein, and he needs proteins, fats, and carbs. Is that clear? Marasmus means mara hua. ठीक है ना? Now we have a classical sign in case of a Kwashiorkor in the hair called as which sign? Flag sign. What is the type of a face seen here? Moon face. Chipmunk face is seen in thalassemia. ठीक है ना? Moon face is also seen in Cushing. Lemon on stick appearance. related to which levels? Cortisol levels, है ना? चलो, मून फेसेस और ओल्ड मैन फेसेस भी लिख सकते हो, ठीक है? That is seen in marasmus. Now, what is the recommended vaccination schedule for the post-exposure prophylaxis for rabies in a previously vaccinated individual? Okay. Now you have a patient coming to you. What will be your post-exposure prophylaxis who has been already vaccinated? The patient has been already vaccinated. What will be your answer? 0 and 3. You will just give 2 doses, 0 and 3. Now let's discuss a bit about rabies. So rabies is caused by which virus? Which virus? अभी बोला था ना, लिसा वायरस. विच वायरस? लिसा वायरस. रिजर्व वायरस, रैबिड एनिमल, ठीक है ना? नाउ दिस रेबीज microbiology, which shape? Bullet shaped. Rabies virus, which shape? Bullet shaped. Now what are the pathological bodies we have in Negri? The first site of form is hippocampus. Second site is cerebellum. Second site is cerebellum. First is horn of hippocampus. Second is cerebellum. They have a hydrophobia as well. वो तो पता ही होगा. Now this rabies patient is coming to you. You should know that the case fatality of a rabies is 100%. What is case fatality of it? Killing power of a disease or the virulence power of an organism. Is that clear? Or the severity of disease. This is all based upon what? Case fatality rate. Now a rabies patient is coming to you. First of all, if you have a, usually we have which bite? Dog bite. So we have a grade 1, 2, 3. Licking, scratching, blood is coming out. Grade 3. Only lick. Grade 1. 2 is scratch. Grade 3 is blood coming out. ठीक है? Now patient is coming to you. You have two patients. नहीं, हम 3 patients को लेते हैं. First patient A, he's going to get a dog, buy a dog, and now he wants to get vaccinated. So pre-exposure prophylaxis. Second patient, he's already vaccinated, but now he got a dog bite. So he's a vaccinated person coming to. The third person is someone who is not vaccinated at all and have a dog bite and coming to you. Is that clear? Now the first person is coming to you before a dog bite. What will be the vaccination schedule? Not scratch. He's just pre-exposure, before dog bite. Normally he's coming to vaccinate himself. So before bite, what is the vaccination schedule? Yes, 0, 7, 21 or 28. How he will come? 0, 7, 21 or 28. Now if someone who is already vaccinated, 0, 3. How many doses? 0. If less than 3 months, don't need to do. More than 3 months, give 0, 3. Now someone who is not vaccinated at all, 5 doses. What is that? 0, 3, 14, 28. One regime. Next regime, 0, 3, 7, 28. Direct, only 4. Is that clear? Depending whether it's a thigh regime, intradermal, whether it's a intradermal or it's intramuscular, whether it's SN regime or thigh Red Cross regime. And we also give serum at the type at the place of wound. Directly देते हैं, ठीक है? 1/3 और बचा हुआ you can give in the alternate buttocks or the IM. ठीक है? Understood? But what is the main important question they will ask? Patient is coming, what is your vaccination schedule? If a patient is already vaccinated, और 2 सालों तक उसको नहीं हुआ, repeat the booster dose every how many years? 2 years. Is that clear? Yes? Chalo, right. So what is the answer here? He was already vaccinated. Okay? 0, 3. Grade 1 के लिए क्या करोगे? For grade 1, wash that. ठीक है ना? Licks unbroken. Wound management, sir, wash extensively with soap and water for 15. One more question. Which of the following is not done in a treatment of a patient having rabies or dog bite? Not rabies, dog bite हो गया. क्या नहीं करोगे? Answer is going to be suture नहीं करोगे. Why? Because उसकी वजह से virus will go deeper and can cause more problem. ठीक है ना? So suture नहीं करते bone में. You just wash it, keep it open, clean. That's it. Class by 2, it scratches without bleed. So what is the local wound management plus vaccine? But if it the multiple scratches and the losing of blood and lacerations are there, you will give vaccine plus rabies immunoglobulin. You will give rabies immunoglobulin. So rabies vaccination schedule. Pre-exposure, that means Before bite, the day 0, 7, 21, 28. Sir, post exposure prophylaxis after bite. So we have a SN regime. SN regime is intramuscular. 0, 3, 7, 14, 28. सही हो गया? Yes. Then we have a thigh regime. Intra 0, 3, 7, 28. Is that clear? Yes. Chalo. Then we also give rig serum at the type at the place of the wound by 40 international units per kg. Okay, 1/3 वहां दे दो, rest of the in the IM muscles, buttocks पे दे दो. Is that clear? But what they will ask, this much. Okay. Now, if post exposure vaccinated less than 3 months, wash the. Is that clear? Yes. Clear होगा? ठीक है. Rabies. What is the name of virus? Lissa. What is the shape? What are the bodies? First found in second found in clear, and case fatality rate of हो गया. Anything else in the rabies? कुछ भी नहीं है. ठीक है ना? पक्का पक्का क्वेश्चन है ना. डॉग बाइट तो कॉमन है इंडिया में. और कुछ रेबीज के बारे में? दिस इज मोर देन इनफ. कुछ है बताओ. हाँ, वो अबनॉर्मल मूवमेंट्स में डिफेक्ट किसका होता है? डाइनिन का. गुड. सही है. स्पीड ऑफ वो फिजियोलॉजी है. स्पीड ऑफ ये ना, ये यस यस, दिस इज अगेन एमसीक्यू. यस. 50 male presented in a medical emergency with the complaints of fever and headache. On examination, neck rigidity. Fever, headache, neck rigidity. Classical case of? बता दो. What will be the CD4 count? Yes. Should be 200 to 100. ठीक है ना? Now fever, headache and neck rigidity. Classical diagnosis is meningitis. Headache and neck rigidity. You can say hemorrhage or hypertension. है ना? Or hypertension. If a patient is having subarachnoid hemorrhage, what is the drug? Nimodipine. If a patient is having increased intracranial pressure, what is the drug? Manage. But if patient is having active bleeding, then अब उसको मामूली सा होगा, उसको भी सर्जरी थोड़ी करेंगे. एसिटाजोलामाइड और ग्लाइसरॉल. एसिटाजोलामाइड और ग्लाइसरॉल. हाँ, अगर सीवियर है, यू गो फॉर वेंट्रिकुलोस्टोमी और द बर्र होर सर्जरी. कहां पे करते हैं? टीरियन. एडीएच में आर्टरीज, मिडल मेनिंजल. इतना ही है ना. और उसमें देंगे निमोडिपिन, उस वाले में देंगे निकार्डिपिन. है ना? और प्यूटामिन इज द मोस्ट कॉमन साइट फॉर हाइपरटेंसिव ब्लीड. That's all. Which condition your MRI CT will be normal? Diffuse axonal injury. उसमें the investigation of choice goes to the MRI. ठीक है ना? रेडियोलॉजिस्ट मत बनो. T2V2 MRI. ठीक है ना? उतना काफी है हमारे लेवल तक. वो पूछेंगे फिर T2V2 वो क्या टाइप्स ऑफ, ये फिर तो हम रेडियोलॉजिस्ट बन गए. Opportunistic infection based upon CD4 count. Now, no, more than 500. What are the opportunistic? what are the what are the opportunistic infections? The infections which are there when the immunocompromised state. What is the most common infection in most common opportunistic infection in pregnancy in perperium? वो तो causative agent बता रहा है तू. What is perperium? Period of after delivery 6 weeks, है ना? It's a period in which a body have a which change organ change and some physiological change. जो pregnancy में उसकी change आई होती है, they will get back to the normal in which stage? Perperium stage. Then you have lochia, rubra, serosa, alba. Then you have some abnormal perperium change where a patient will have, because the state is still immunocompromised, so patient is having infections. What is the most common infection? Endometritis. What is endometritis? मुझे पता है एंडोमेट्रियम ही बोलोगे तुम लोग. यूट्रस का इन्फेक्शन. ठीक है ना? इट प्लेसेस विद द यूट्रस का इन्फेक्शन. मोस्ट कॉमन इज एंडोमेट्राइट caused by enteric bacteria. Caused by enteric bacteria. Then other abnormal conditions, we can have mastitis caused by Staph aureus. We can have UTI caused by E. coli. All these things. Okay, but most common is going to be endometritis. Patient को fever है, false smelling discharge है, all. One more question is sequence of this secretions. Lochia. What is lochia? Secretions. Rubra, serosa, alba. ठीक है ना? यूटीआई में व्हाट्स द ड्रग ऑफ चॉइस? नाइट्रोफिरेंटोइन वी यूजुअली गिव. ठीक है ना? क्या देते हैं? नाइट्रोफिरेंटोइन देते हैं ना? मैस्टाइट्स में एमोक्सिसिलिन एंड जेंटामाइसिन. एमोक्सिसिलिन एंड जेंटामाइसिन, है ना? नाउ यूटीआई में वी कैन यूज आल्सो नॉरफ्लॉक्सासिन, ओफ्लॉक्सासिन एज वेल, डिपेंडिंग. ठीक है ना? व्हाट इज द ड्रग दैट विल एक्ट ऑन द ब्लैडर? व्हाट आर द ड्रग्स एक्टिंग ऑन ब्लैडर इन केस ऑफ बीपीएच? जब पेशेंट इज नॉट एबल टू urinate, so there is something wrong. Drugs acting on bladder started with the oxybutynin. पढ़ा है ना? Flavoxate. Yes or no? नहीं. कोई बात नहीं. चलो 500 to 200. The infections we are going to have a tuberculosis. Most opportunistic infection in TB is, in HIV is TB, but in India TB, outside Girovesi. Okay. Second one is going to be candidiasis. And third one is going to be Kaposi sarcoma. Kaposi sarcoma. Candidiasis is oral thrush, है ना? Caused by. अब एक oral thrush किससे होता है? Inhaled cortico. Which inhaled corticosteroid does not cause the candidiasis? NEET PG pharmacology recall question. Which drug, which inhaled corticosteroid does not cause what? Oral candidiasis. है ना? Yes, anyone? Very nice. Cyclonoside. Started with C. ठीक है? Remember these things. ठीक है ना? This is a which PYQ. नीट पीजी PYQ. इसका मतलब तुम लोगों ने अभी PYQ फार्मा का नहीं किया है. चलो, good. Next, if the CD4 count is between 200 to 100, what are the infections? Pneumocystic girovasi, pneumonia, and cryptococcal meningitis. Cryptosporidium is the most common cause of diarrhea in HIV patients, है ना? Not an opportunistic infection. Between 100 to 50. Toxoplasmosis, less than 50. CMV retinitis. Now let's integrate them with the medicine. Chalo, this one, multiple eccentric dots. Cerebral toxoplasmosis. चलो यहाँ पे लिखते हैं cerebral toxoplasmosis में we have a tried HCC. What is that? Choreo. Clear? Tried. So treatment. Pyrimethamine. Leucovorin is another name of folinic acid, है ना? Sulfazidine. ठीक है? If pregnancy, what is the treatment? Spiramycin. All done? All done, guys? Yes? चलो. Ophtha में क्या होगा? Headlight in fog appearance. But clinical feature, sir, patient will complain of seizures caused by toxoplasma gondii. This is all about your toxoplasmosis. Now, how do you differentiate, sir, with neurocysticercosis? No, same will be here. There is an active larva assay. At that time, it's going to be what? Neurocysticercosis, where the treatment is what? Albendazole plus steroids. Steroids we can give. Chalo. ठीक है? Is that clear? Cerebral toxoplasmosis. Next, this is going to be tumor of the skin mucous membrane called as Kaposi sarcoma. HHV 8. Okay? And what is the treatment? Surgery with chemoradiation. Is that clear? Next, what are the malignancies with HIV? Kaposi sarcoma. Then cervical cancer. And then non-Hodgkin's lymphoma. Most common is going to be non-Hodgkin's lymphoma. Okay? After that, you have a fundoscopic picture of a patient having a pizza pie appearance. And the spots called as cotton wool spots. What is your diagnosis? CMV retinitis. Your most repeated question, drug of choice. Jancyclovir. Please never mark what? Acyclovir. Acyclovir, herpes. ठीक है ना? चलो. Next. You have pneumocystic gyrovesi. Pneumonia less than 200. On chest X-ray, you will have a perihilar opacities. Okay, but drug of choice is going to be clotrimazole. Okay, what is the stain for PJP? Gomori, methamine silver stain. GMS stain. Gorots or Gomori methamine silver stain. Last one, cryptococcal meningitis. CSF test में which ink? Very good. India ink. What is drug of choice? Liposomal amphotericin B. All clear? This is all about your opportunistic infections. Okay? These are the infections they can ask. है ना? तो from medicine point of view, any other point you can add? No, sir. यहाँ पे इंडिया इंक भी करते हैं आजकल और क्या करते हैं? एलाइसा भी करते हैं. ठीक है ना? Then please go with that table. Cryptococcal meningitis, viral meningitis, bacterial meningitis. What will be the TB? What will be the color of the fluid? Okay? CSF. What will be the glucose level? Lymphocytes. है ना? Viral meningitis, drug of choice? Acyclovir. है ना? acyclovir. Then we have a classical two sign, Kerning sign and Brudinski sign. Kerning sign and Brudinski sign. Chalo. Under the ASI Act, the sickness benefit is given for a period of how many days? 91 days. Okay, now let's understand this ESI Act. Employee State Insurance Act, it includes the all industries except except railways, defense and mining. There will be pre-medical care inpatient department plus outpatient department. Sick leave for how many days? And salary will be extended sick leave benefit for 2 years, something 80% salary. Maternity leave for, and the salaries full. Enhanced leave, vasectomy, tubectomy, disability benefit, leave till recovery with 100% salary. Permanently, pension as per guidelines. Funeral benefits 15,000. हो गया? Okay. And what will be the contributor of employee? कितने percent? 0.75% of wage. And here 3.25% of, and this is going to be the logo of ESIC Act. Is that clear to everyone? Yes. Very fast. Remember, sick leave for how many days? 91 days. Extended sickness for 2 years. Vasectomy, 7 days. Tubectomy, 14 days. Maternity, 6. Funeral benefits, 15,000. Temporary disability, till recovery. And then the last one, permanent is as per the guidelines. ठीक है ना? Simple question will be asked. Now what they can ask is, now these days, which of the following is wrong? So they will mention 91 days is salary leave, but the salary is 90%. So you have to remember 70%, 80%, rest all 100%. Yes? Chalo. HIV positive mother who is taking ART treatment delivers a healthy baby with a birth weight of 3 kg. Started ART treatment just 4 hours after the delivery. What is the level of prevention? Mother is HIV. Secondary कहां से हो गया? ठीक है, कोई बात नहीं, मैं बोला. Mother is HIV. ठीक है, mother is HIV positive, but the baby is negative. But mother is a risk factor. Baby को हो रहा है? नहीं. Risk factor is present. You try to prevent the disease. Same question. Same question. If I will write mother here, then comes the secondary. आ गया समझ? If I talk about mother, then it's going to be secondary. If I talk about baby, then it's going to be primary. Okay. Now you already know about a level of prevention. You already know about level of prevention. There are two ways, either pre-pathogenic or pathogenic. Okay. Now pre-pathogenic, before the disease, what you can do? Two things. Primordial and primary. And here, pathogenic mein secondary and tertiary. Now, sir, level of prevention. Before the disease, what you can do? Either you can stop the risk factor or you can stop the disease. That is going to be your primordial and Primary. After patient has disease, either you can give treatment, secondary, or rehabilitation complication, tertiary. ठीक है ना? Simple. Now level of prevention. If I talk about sir primordial, ठीक है? Primordial. What is primordial? Prevention of risk factor to occur. आप risk factor को ही रोक रहे हो आने में. For example, if there is a cooler, you're changing the water of cooler every 3 days, every 1 week. Will the mosquitoes come? No. So changing the water of cooler every 1 week is a which level of prevention? Primordial. Now mosquitoes are there. Are you getting my point? But you are in the bedroom. You are using mosquito nets. Risk factor for malaria is mosquito. But you prevent yourself from the mosquito. Risk factor is present. Mosquito net is a primary. अब तुम लोगों ने मॉस्किटो नेट भी नहीं रखा, फीमेल एनोफिलस बाइट मार गई, व्हाट इज हैविंग? मलेरिया. यू आर गोइंग टू हॉस्पिटल हैविंग रैपिड डायग्नोस्टिक टेस्ट, हिस्टडीन रिच प्रोटीन, पेरिफेरल ब्लड स्मेयर एंड टेकिंग क्लोरोक्विन, सेकेंडरी. आफ्टर लॉन्ग टर्म यू हैव हैविंग कॉम्प्लिकेशंस, टर्शियरी. समझ आ गया? तो स्टॉपिंग द रिस्क फैक्टर टू ऑकर सर, दैट इज अ प्री पैथोजेनिक फेज. यस और नो? यस सर. इफ आई टॉक अबाउट प्राइमरी, व्हाट इज दैट? Prevention of prevention of disease in presence of risk factor. Again, this is going to be what? Pre-pathogenic phase. Then we have secondary. What is that? Early diagnosis and treatment. That is early diagnosis and treatment. All the investigations are secondary level of prevention. All the treatment drugs are secondary level of prevention. All the vaccines are primary level of prevention. But you have a patient coming to you with a painless hematuria. What is your diagnosis? Dimag mein. Bladder cancer. Bladder cancer. Hematuria. Painless. Now, BCG vaccine in bladder cancer is a which level of prevention? Secondary. Why? Because here I'm using BCG as a treatment. Okay, na? Bladder cancer. Exposure to aniline dye or benzidine. If exposure to benzene, leukemia. Exposure to polyvinyl chloride, angiosarcoma of liver. Exposure to arsenic or thorotrust, again angiosarcoma of liver. Exposure to oil, grease or chemicals, skin cancer. Exposure to asbestos, lung cancer. Is that all? Benzene, बेंजीडीन. बेंजीडीन में क्या आता है? डी. और ब्लैडर में भी क्या आता है? डी. ऐसा याद रखना बस. बेंजीन ल्यूकीमिया, ब्लड कैंसर. इज दैट क्लियर? सो प्लीज रिमेंबर, बेंजीडीन में डी आता है और डी. एनालिन डाई भी पूछ सकता है, ब्लैडर कैंसर. इज दैट क्लियर? यस. चलो, इट इज अ पैथोजेनिक फेज. It is a pathogenic phase. Then we have next one, tertiary. Okay, and tertiary, in which we have a management of we have a management of complications and disability. ठीक है ना? And it is which pathogenic? Late pathogenic. ठीक है ना? For example, clutchers in the polio. ठीक है ना? For example, clutchers in the polio. Now, vaccine is a which level of prevention? Pap smear is a mammography is a changing of water in cooler every week. Use of mosquito nets. Encouraging students or kids for outdoor activities. Primordial. Primordial. ठीक है ना? चलो. If you want to check the incidence of deafness, online people, all clear? चलो तुम बता दो. If you want to check the incidence of deafness caused by the noise in the office workers, factory workers after 1 year, which type of study you will be? Right now is 2024. I am going in the future, 2025. When you go from risk factor to disease. Yes, ma'am. Risk factor to disease. It's called which type of study? Cohort study. It's called as which type of study? Cohort study. Now, if I talk about this cohort study, if I talk about the epidemiological classification of epidemiology and the classification of the studies, what is epidemiology? Study of what? Disease, about its what? Determinants, causative agents, and the ways you can control this. है ना? Distribution, determinants, and factors. Now, what are these factors? Frequency, incidence, prevalence. Now, you'll study a one disease. We'll say at what time it occurs, at which place it occurs, and which people it really affects. Then we'll check this disease. Okay, what is the incidence and prevalence of this disease? Are you getting my point? Then we'll see how we can control this disease. So we all do this in where? In epidemiology. So when we take one disease first, when we take one disease first, first of all, we need to make the hypothesis. Why I'm telling is hypothesis? Because it's not confirmatory yet. Here is something confirmed. Okay. So first of all, when you take some disease, you need to know about the distribution. What is distribution? Time, place, person. Just say, for example, in rainy seasons, which disease is most occurring? डेंगू होता है ना. फॉर एग्जाम्पल प्लेस वेस्ट बंगाल और बिहार में क्या होता है? काला अजहर. अफ्रीका में क्या होता है? बर्किट्स लिम्फोमा. चाइना में क्या होता है? नेजोफेरेंजियल कार्सिनोमा. साउथ स्टेट्स में क्या होता है? एचआईवी. तो पर्टिकुलर डिजीज. पर्सन, बच्चों में क्या होता है? मीजल्स. फीमेल्स में क्या होता है? ब्रेस्ट कैंसर. मेल्स में क्या होता है? लंग कैंसर. सो पर्टिकुलर पर्सन. बन गया हाइपोथेसिस. देन वी हैव टू डू व्हाट? Analyze this hypothesis. Okay, analytical or a testing of this hypothesis. We do a study on this. I will do cohort, I will do case control, I will do cross sectional, I will do ecological study. Now पहले मैंने क्या किया? What is the first thing you need to make? Hypothesis. मैंने एक disease को उठाया, time, place and person. Now second part, I will analyze this hypothesis. I will test this hypothesis with the help of a studies. What are the studies? Cohort, case control, cross sectional, ecological. After that, we have a first, let's write this much, okay? Right, so we have two things, right? So we have classification, observational, and we have experimental. Okay, we have observational and experimental. Is that clear? Sir, in observation, we have two. We have descriptive hypothesis and analytical hypothesis. Sir, in descriptive hypothesis, that means you have to form the hypothesis with the help of TTP, time, place, and person. I already told about time, particular time पे कोई disease होता है, particularly affecting our age group, or particularly in one place, like Kala Azhar in Bihar. उसके बाद we do analytical hypothesis, we test these hypotheses. We will see, is it true? Can we confirm that after 10 years of consuming smoking, you will have a lung cancer? After consuming alcohol for 5 years, you will have a liver cancer. Are you getting my point? After taking OCP for a long time, you will have hepatic adenoma. So that means when I'm doing such study, I need to go where? Analyze करने. So first study I will do is called as cohort study. Depending upon the condition, we have different types of study. Let's understand each study. Second one is going to be your case control. Third one is going to be your cross-sectional. Fourth one is going to be your ecological. Is that clear? Clear हो गया? Clear हो गया? उसके बाद we have an experimental. That's a hypothesis confirmation. What are we doing there? RCT, then field trial, then commercial trial, community trial. Is that okay? And clinical trial. Experiments like on drugs, clinical trial, phase 0, phase 1, phase 2, phase 3, है ना? Is that clear? Now let's study. Sir, what exactly is this? Which study? Cohort study. समझ आ गया डिस्ट्रीब्यूशन का टाइम प्लेस पर्सन. अब मैंने इसे एक स्टडी उठा दी. Now, the first study is going to be cohort study. Now, see, 2024, ठीक है ना? I am doing a study on you guys. Out of how many students you will take my lecture and pass the exam? So, which direction I'm going? I need to wait. Yes or no? So I'm going in a forward direction. You will give exam on 12 Jan. Then meanwhile, I will confirm result आया नहीं आया. Result आएगा, I will get back and see how many of you passed. Are you getting my point? Are you getting my point? So simple means you all people are, or there is a 10 people in the group, they are smoking. And I want to know that if they smoke for 10 years, what will be the incidence of what? Lung cancer. So what is smoking? A risk factor. What is a lung cancer? So can I call it a risk factor to disease? Yes. Okay. Then what is smoking effect? What is the smoking is cause. That is effect. Can I call it cause to effect? Yes. Can I call it as I'm going from 2024 to 25? Can I call it as forward looking study? Yes. Can I call it as prospective study? Very simple. But these 10 people who are smokers, I am checking for which cancer? Lung. So I need to continue follow up. Yes, I will see somebody is 70 kg, इसको जल्दी कैंसर हुआ, somebody is 50 kg, इसको लेट हो रहा है, somebody is 85 kg, इसको ज़्यादा लेट हो रहा है. So I need continuously follow up on the studies. I need to call them, come for chest X-ray, come for HRCT, come for the fibrosis. Are you getting my point? So what do I need for investigations? So it's expensive. And again, I need to wait. So it's a time. One more reason, I need continuous follow up. अब तुम 10 लोगों में से कोई कनाडा चला गया, I lost the follow up. I lost the case. So cohort study, it's a time consuming study, sir. It's a expensive study, sir. It's loss of follow up is a disadvantage. I can lose the case, and it's a forward looking study. Risk factor to cause, risk factor to disease, and cause to effect study. आ गया समझ cohort? Now the strength of association. There are some things I will check in which study? Cohort study, like relative risk, like incidence, like popular attribution risks or attribution risk. समझ आ रहा है? Are you getting my point? So whenever you are relative risk in mind, incidence in mind, think of which study? Think of which study? And whenever odds ratio, case control. Cohort समझ आ गया? Cohort समझ आ गया क्या है? Simple case they will give. Simple case they will give. Understand, I am giving in future or I am going in past. समझ आ रहा है? ठीक है. For example, there are 3 females. ठीक है? During the pregnancy इन्होंने क्या पिया है? शरबत, sharab, alcohol. Okay. Now, after they have, after they deliver, after they delivered, I'm checking their babies. Okay, fetal alcohol syndrome. I'm checking the babies. Are they underweight and all? So I'm asking them. They came to me. I'm asking the history of what? Alcohol. So I'm going backward study. I have a patient coming to me. I'm seeing there is a cirrhosis of the liver. What is my first question? कब से पी रहे हो? So I am going which? पीछे. I have a patient coming to me with a lung cancer. मैं तो पूछूंगा smoking ये कब से कर रहे हो? So when you go for backward direction, so backward में पहले आपके पास क्या है? What do you have in front? Disease. So you go disease to risk factor. Yes, you go effect to cause. Forward, is it back? Prospective, this is यहाँ पे. Do I need any follow up? No. Do I need any money? No. Do I have any chances of loss of case? No. So this is fast study, this is cheap study, this is expensive, this is slow study. This is forward, backward, prospective, retrospective, risk factor to cause, cause to risk factor. ठीक है ना? Is that clear? Disease. Is that clear? समझ आ गया? Understood? Now, sir, incidence, relative risk, attribution risk, population attribution. These are all calculated where? Odds ratio, case control. आगे गए और पीछे आए. Now, if you are doing a study at one point, that is going to be your cross sectional study. It's also called as snapshot. If I'll take a picture of you guys, पिक्चर में फॉरवर्ड कर सकता हूं? नहीं. बैकवर्ड कर सकता हूं? नहीं. एट अ पॉइंट अगर तुम पोज दे रहे हो ऐसे ही आओगे. दिस इज कॉल्ड विच टाइप ऑफ स्टडी? क्रॉस sectional study, also called as snapshot study. And this study is telling me about a prevalence of the disease. क्या बता रही है? So prevalence is checked in, odds ratio is checked in, incidence is checked in. समझ आ रहा है? Whenever you have a hint, relative risk की बात कर रहा है, cohort सोचो, odds की बात कर रहा है, case control सोचो, and then the next one, prevalence की बात कर रहा है तो cross sectional. After that, ecological study. It will tell me about the characteristic of a population. For example, this age group, 70 to 75, they need 3000 calories per day. So the type of study that I will do on that, nutritional surveys, for that type of study, I do what? Ecological study. आ गया समझ? समझ आ गया? Epidemiology में one question they will ask directly case कि पूछ क्या रहा है? Understand the situation. एक question आएगा calculation का. From last two exams, calculation coming. What the calculation they have asked? Relative risk. Sir, what is relative risk? Incidence in expose upon incidence in non-expose. एक numerical करेंगे, समझ जाएंगे, बात आसान होगी. Is that clear? थोड़ा सा आ गया दिमाग में epidemiology? A little bit, 10%. ठीक है. 90 आ गया. चलो, just right now. Cohort study. It's prospective study. Online people, you got it? Yes. Are you understanding? You guys are not fast today. I don't know why. Everyone. क्या बता रहे? Case control study. Can you please repeat? Yes, I can. मैंने बोला, a patient is coming to you. He's having a lung cancer. आप what is the first question you will ask the patient? आप कब से पी रहे हो? Are you smoking? So you are going back in time. आपको पता है कि रिस्क फैक्टर भी था, आपको पता भी है डिजीज. नाउ यू आर गोइंग बैक इन टाइम टू चेक व्हाट वाज द रीजन ही हैड व्हाट? लंग कैंसर. अब वो बोलेगा कि नो, आई एम नॉट अ स्मोकर. सो ही विल चेक वेदर ही हैज एक्सपोजर टू एनीथिंग. आर यू गेटिंग माय पॉइंट? वेदर ही हैज सम हिस्ट्री or whether he was working somewhere in any industry. So you're going from disease to the risk factor. So you're going in the backward position. Okay, this is called as case control study. That means disease is present. You're going from disease to find. Now diagnosis is here. What is diagnosis? Lung cancer. What you're trying to find now? Risk factor. So this is called as case control study. Okay. Forward में जाओगे तो cohort study. चलो. One question on case control is coming. One question on cohort is coming. One question on relative risk is coming. While solving the question, I will again repeat. ठीक है? चलो. Prospective study, also called as which direction? Forward looking study. Cause to effect study, or also called to risk factor to disease study. Okay, my dear students, this is a time consuming study and it needs continue follow up. It needs continue follow up. Okay, then the results are calculated by strength of association, incidence, sorry, relative risk, PAR, AR. Is that clear? Now, sometimes you have a mixed studies, control and case, दोनों साथ में. Now, first we have retrospective. Direction is forward, but then on the same study you come backward. That is called as retrospective cohort. Are you getting my point? From 2024, I'm going 2029. From 29, I'm going 2018. This is called as retrospective. Then what is a mixed cohort? 2025 to 29, 29 to 2017, then again from 17 to 2040. Forward, backward, forward, mixed cohort. Forward, backward, retrospective cohort. That means you're doing study same chal rahi hai. I started a study. From where? 2024. Smoking. To which cancer? He's smoking. I am waiting 2020, 2025, 26, 27. 26 में I got to know he's working in asbestos industry, shipyard industry. So I am going back in time. वहां पता चलता है it is retrospective. वहां पता चलता है नहीं कर रहा है और जा रहा हूं वापस. Are you getting my point? Are you getting my point? So forward, backward, retrospective. Forward, backward, forward. That's going to be your mixed study. Mixed cohort, retrospective cohort. First of all, what is retrospective, bachcho? Sir, direction is forward, but we go back in time 10, 20 years. And from the hospital records or data, we found out exposed and non-exposed people or data. हमें पता चलता है इनके बारे में. We check in current time how many of those are exposed or non-exposed having the disease. This is going to be retrospective. Sir, what is going to be mixed cohort? Retrospective. You go, my dear students, forward and backward. This was which study? Retrospective. But if we do another study for 10 to 20 years, then again you are going where? Forward. That is going to be mixed cohort. Is that clear? Samajh aa gaya? What is mixed studies? When you do both forward and backward in one study, those are called as mixed studies. Okay? Now, results are calculated by, sir, relative risk, attributable risk, popular attributable risk. Is that clear? Yes. Now, देखो आराम से, ठीक है ना? Don't be scared of these numericals. They are basic. ठीक है? A study was conducted to assess the association between smoking and the lung cancer. The data was given. आपके पास data आया. You have a total of 100 smokers. 60 got the disease. 40 absent lung cancer. Is that clear? Then you have non-smokers. Smokers मतलब exposed. Non-smokers मतलब है ना? 100 people are there. 80 have absence and 20 present. Okay, 20 people have lung cancer, but they are not exposed to smoking, and 60 people have cancer, they are exposed to the smoking. So what we have to calculate? Relative risk. Sir, RR. Incidence in upon incidence in non-exposed. Sir, what is exposed? Smoker. What is non-exposed? Non-smoker. Incidence in exposed is 0.6 है ना? टोटल कितने हैं? 100 है ना? Incidence in non-exposed is 20 by 0.2. 0.6 by 0.2. 2 ones are 2 threes are. What is your answer? समझ आ गया? Everyone got it? Yes? ठीक है ना? So incidence is 3 times more in a people who are smokers. Is that clear? Is that clear? Simple याद रखना, incidence in exposed upon incidence is non-exposed. This is the question that they have asked. Incidence in non-exposed, out of 100 people, only 20 had a cancer. So 0.2 और वहां पे 0.6 है ना? समझ आ गया? और एक बार बताता हूं. आ गया? इनको नहीं आया. To calculate the relative risk, लेट हो गया? अच्छा. Incidence in exposed by incidence in non-exposed. What are the people who are exposed? Who are smokers? ठीक है? Now smokers, how many people you have? 100. Out of them, how many develop a lung cancer? 60. 60 by 100 is 0.6. So incidence in exposed is 0.6. Now non-exposed people, non-smokers, कितने थे? 100. But still, how many of them develop the cancer? 20. 20 by 100, 0.2. So 60 by 20 लगा दो. 3 or 0.2 by 0.6 by 0.2 लगा दो. The answer is going to be 3. So the incidence is 3 times more in the people who are having smokers. Is that clear? आ गया समझ? All the online people. Online people. Yes? Everyone. आ गया इनको समझ. Good. Chalo. A woman in the age group of 25 to 45, 10 pass, same village resident, well communication skills, she can work as Asha, accredited social health activist. Is that clear? Asha. Sir, now, what is the criteria for Asha? Question में दिया हुआ है. 25 to 45, 10th pass, married or divorced, communication skills, same village resident. It's not like that. She's from Delhi and she want to work in Manipur. ऐसा नहीं होगा. ठीक है ना? She should be the resident of same village. Asha is going for the surveillance of which disease? Leishmaniasis and filariasis and also sometimes tuberculosis. ठीक है? Now, grass root level workers in the village. Now बच्चों, village में कौन कौन सा चलता है? First question was asked FMG PYQ. Out of which of the following is not a village worker? Direct answer बता दो. Auxiliary nurse, midwife. है ना? चलो. Asha, let's study about traditional birth attendant, village health guide, Asha, and Anganwadi worker. Location, all are at the level of village. Population, chalo bata do. One per one village. Education for TBA is not required. Okay, training duration for 30 days. And she's trained by multi-purpose worker, female. Okay, or medical officer. Okay, next, village health guide. She'll work at the level of village. Population is 1 per 1,000. Education, 6 pass. And then training duration, 200 hours or 3 months. And she's trained by medical officer. Important one is going to be Asha at the level of 2 per 1. Before it was 1 per 1,000. Now, before it was 8th pass, now it is 10th pass. She's trained for how many days? 23 days. And she's trained by Anganwadi worker or multi-purpose worker, female or medical officer. हो गया? Now, Anganwadi worker. She's at which center? ICDS center or Anganwadi center worker. Okay. In plains, 1 by 400 to 800. Okay. But in hills, 300 to 800 in the hills. Education, 12th pass. Training duration, 4 months. And trained by community development project officer. Is that clear? Is that clear, Rucho? Yes. Community development project officer. Now, what are the functions of Asha? She's a part of a scheme, Janani Suraksha Yojana. Okay. Second thing, sir, home delivery of contraception. Second, third thing, she's giving a treatment for minor ailments. थोड़ा headache हो गया and all. ठीक है ना? She's giving treatment for minor ailments. India में कुछ भी देते हैं. And she's going for active disease surveillance like TB, filariasis, leishmaniasis. Is that clear? Is that clear to everyone? Yes, that is the Asha. So remember Asha, 10th pass, 25 to 45, same village worker, married or divorced, good communication skills, Asha. Training 23 days, trained by Anganwadi worker, medical officer. Then a part of JSY, home delivery of contraception, minor ailment treatment, and active disease surveillance. Is that clear? Chalo. Blood pressure of 3 groups, A, B, and C. was measured and a mean BP was calculated. Three, yes, करते हैं पहले ना. Okay. A blood pressure of three different groups A, B, and C was measured and mean BP was calculated out of it. The three means are different. The most appropriate test to determine the significance of difference between mean is so no. So whenever you talk about a data, understand biostatistics में एक ही चीज इंपॉर्टेंट है ना. अब मीन मोड मीडियन तो निकालेंगे नहीं, ठीक है ना. अब सुनो, first of all you need to find a data, which type of data it is, whether you can count or whether you cannot count, whether you can measure or you cannot measure. If you are able to measure, it is called as quantitative data. If you are not able to measure, it's called as qualitative data. So पहली बात क्या करना है ऐसे क्वेश्चंस में, आपको पहचानना है, you have to know whether the data is quantitative or whether the data is qualitative. What you can measure: blood pressure, HB, cholesterol, weight, height, width, breadth, सब कुछ है ना. What you cannot measure: blood group, anemia, disease. Are you getting my point? Yes or no? Can you measure cancer? Can you measure? No, sir. We cannot measure these things. Why? Measurement is not possible. Now, when we see a type of data, then we have some scales or qualitative data, like measurement scales we have over there, where we know as per the degree. For example, for cancers, we have stage 1, stage 2, stage 3. Are you getting my boss? Nominal and ordinal, based upon the orders or based upon the stagings, and a TNM staging. But here measurement is possible, so we can go with mean, mode, and median. है ना? You have already studied that. Now, how to differentiate these questions? Now, you have a group of people. Okay. Now, whenever I will talk about the type of test in a quantitative data, that means I'm talking about parametric test. किन test के बारे में बात कर रहा हूं? Parametric test. ठीक है? Whenever I'm talking about which type of data that you can measure. So which test I'm talking about? Parametric test. So you see in questions that the data is measurement. You are going for which test? Parametric. Yes or no? Yes. In question, it will be mentioned. Measurement is possible? Yes. So you will check what? Either they will say mean calculate or standard deviation. Two things you have to see in the question. What? Mean and standard deviation. Now the measurement is possible. Yes or no? Yes, sir. Now one group is there. Patient is having cholesterol. What is patient having? Cholesterol. This group is coming to me every everyone, the cholesterol level is above 200. What is the drug I will start? Hypolipidemics. Statins. What is an enzyme they inhibit? HMG CoA reductase. I'm starting the drug in these 10 people. After 2 months, I'm telling, come back. So before intervention and after intervention, same 10 people. Yes or no? Yes. Yes or no? Yes. One type of test. Okay? Now, 20 people. 20 have cholesterol. 10 want to take medication, 10 don't want to take medication. I'm telling 10 people take medication. I'm telling 10 people lifestyle change. So before intervention and after intervention, after 2 months, I will again check the cholesterol. Between which people? Drug wale or no? So this, how many groups? Two groups. दूसरा test. Now, three different groups. Three groups. Are you getting my point? समझ आ गया? एक ही ग्रुप के साथ करोगे, the test is going to be paired student t test. दो के साथ करोगे, unpaired student t test. तीन के साथ करोगे, ANOVA test. Are you getting my point? Are you getting my point? Are you getting my point? Check the question. What has been measured? Blood pressure. Quantitative or qualitative? Quantitative. Which test? Parametric or non-parametric? Parametric. Very good. How many groups? 1, 2, 3. रुको फिर उसके बाद कैलकुलेट क्या किया है? यहां पे क्या दिखा है? मीन. बीपी कैलकुलेट किया, ब्लड प्रेशर था 3 ग्रुप्स का. नाउ टेस्ट ऑफ सिग्निफिकेंस, मीन. So all the hint is there. Sir, mean you said will be there. Parametric test, quantitative data for 3 groups, ANOVA test. For 3 groups, ANOVA test. For 2 groups, unpaired student test. For 1, paired student test. Can we write now? Can we write now? अब आसान लगा ये क्वेश्चन? But the first thing you will see, टाइप ऑफ डेटा, है ना? उसके बाद हाउ मेनी ग्रुप्स, एक है तो, दो है तो, तीन है तो, खत्म बात. सर इट इज फॉर विच टाइप ऑफ डेटा? Quantitative. Every topic can be understood when you put on the right efforts. हाँ वो बात भी है, वो तो 100% है. Student which test? T test. चलो लिखो आप. Sir, if I will mark paired student only, then how many groups? One group. That means before an intervention and after the intervention, same group. Sir, unpaired student test. कब mark करोगे? Two groups. And so I will mark ANOVA test for more than two groups. सीधा. तो क्या mark करेंगे? ANOVA test. Is that clear? Is that clear? Yes. So first important thing बच्चों is क्या? To calculate the, to signify whether the data is calculated or not. Measurement is possible or not. ठीक है? चलो चुपचाप क्वेश्चन पढ़ो और बताओ मेरे को आंसर. A cardiologist wants to study the effect of atorvastatin. Hypolipidemic, मैंने ऑलरेडी बोला सरकारी क्वेश्चन. विच एंजाइम दे इनहिबिट? HMG को ए रिडक्टेज. अगर HMG को ए सिंथेस लिखा है तो कीटोन बॉडीज. सिंथेस लिखा है तो कीटोन बॉडीज. He notes down the initial cholesterol level of 50 patients and then administer the drug on them. After a month's treatment, he measures the cholesterol level again. कौन सा टेस्ट आएगा? Yes, कौन सा टेस्ट आएगा? Paired test. कौन सा, कितने ग्रुप है? Only these 50 patients. Am I comparing with another? No. Before intervention, after intervention is same. So what is the test? Paired student test. Is that clear? If I would have mentioned two groups, my dear students, what will be the answer? Unpaired student t-test. Is that clear? Asan? Yes? All good? Chalo. Non-parametric test. It is for which type of data? Qualitative data. Question में hint क्या होगा? Percentage and proportion. ठीक है? If one paired group, what is the test? Sign test. What is the test? One paired group. And if two unpaired or paired or more than two groups, answer is going to be chi-square test for two unpaired or two more than two groups. Is that clear? Sign test for one group, two or more than two, your answer is going to be chi-square test. Chalo, the test of significance done on two or more proportions, your answer is chi-square, कुछ भी बता दो, test. Is that clear? Is that clear to everyone? Test of significance समझ आ गया? Yes. So what is the first thing, बच्चों, you have to know? Type of data. Then you see, chi-square test is when for a qualitative data, you have two or more proportions. You have two or more proportions or two or more groups, you do what? Chi-square test. Is that clear? But in case of there, one group paired, two unpaired, more than three ANOVA. Is that clear? यहाँ पे sign and chi-square. Very easy. Yes, one question will come. All clear? All clear, guys? Chalo. Next. A case control study is a type of observational study in which two existing groups differ in outcome and identified and compared on the basis of some supposed causal attribute. ठीक है ना? पीछे जा रहे हैं. All of the following are the advantage of case control except, अभी तो बताया मैंने. What is the answer? What is the answer? B. Yes, because relative risk is calculated in which study? Relative किसमें है? Cohort में. Rare disease? Yes. Can odds ratio in case control? Yes. Cost effective or inexpensive? Yes. Cheaper? Yes. So relative risk is a factor of which study, bacho? It's a calculated in cohort study. Incident in expose upon incidence in non-expose. Is that clear? Is that clear? Yes. Chalo. It's also called as which study? backward study or retrospective study, whatever is in the cohort, सबका opposite लगा दो. What is that? Case control. Opposite of cohort is case control. So study from disease to risk factor, or it's also called as which study? Retrospective study. Or अगर it is disease to risk factor, that's already written here. यहाँ पे कर दो risk factor को. It's also called as a retrospective study. Then, or effect to cause study or outcome to exposure study. What is exposure? Risk factor. So exposure is smoking. Here is lung cancer. So I'm going from outcome to exposure. Risk factor is smoking. Diseases. So I'm going from disease to risk factor. So backward direction. Example, number of lung cancer patients had exposure to smoking in the past. Is that clear? So that is which type of study? Case control study. It is very fast because no follow-up and no new cases. Okay, what is incidence? New cases. So incidence in which study? Cohort study. है ना? New cases. चलो. It is also known as, what is opposite of cohort? Crohawk study. क्या बोलते हैं इसको? Crohawk study. And the strength of association is given by odds ratio. Odds ratio is also called as cross product ratio. I'll show you an example on the odds ratio. Then we calculate if it is 1, more than 1, less than 1. What does this signify? Either the relation, either the risk factor is positive, हाँ इसकी वजह से कैंसर हो रहा है. Either risk factor has no association, or it is protective, or either smoking is protective in such conditions. ठीक है ना? समझ आ रहा है? Depending upon the odds ratio. Simple question. Cross product ratio is calculated in which study? Case control study. समझ आ गया? All good? All good? Everyone? Yes तो बता रहे हैं. चलो. In a train accident, 74 dead, 4 severely injured, 15 moderate injured, 22 mild injured. Color coding. Yes, color coding. सी कहां से आ गया? RYGB. रेड, येलो, ग्रीन, ब्लैक. नाउ हाईएस्ट है ना? हाईएस्ट प्राइज प्रायोरिटी किसको दोगे? मैं प्रायोरिटी देनी किसको है? जिनको बचा सकते हैं. जो गया वो है ना, जिसको बचा सकते हैं उसको रोकेंगे. ठीक है ना? कलर कोडिंग फ्रॉम ट्राइज फ्रॉम हाईएस्ट टू लोवेस्ट. हाईएस्ट प्रायोरिटी किसको देते हैं? बचा सकते हैं. उनको भी डाल दिया दिमाग में. चलो, व्हाट इज ट्राइज? सेग्रीगेशन. Segregation of patient based on the chances of survival with best possible treatment available, not on the basis of severity of the illness. Now, red color is given which priority? Highest priority. Okay, because they need a which surgery? Life-saving surgery. And because they need immediate resuscitation. How many hours? 0 to. After that, yellow, given which priority? Medium priority. Okay, they need a surgery within how many hours? 6 to 24 hours. Then green. Low priority. Ambulatory patients. They are having which injuries? हाँ, सब ठीक हो जाएगा. Minor injuries. And then black. Dead or about to die. They are being given least priority. कैसे याद रखोगे? ठीक है ना? Red, yellow, green, black. Which of the following disease? चलो चलो. Which of the following disease does not show iceberg phenomena. Which of the following disease does not show iceberg phenomena? What is the answer? Very good. चलो HIV we discussed, rabies we discussed, malaria we discussed. चलो टाइफाइड के बारे में डिस्कस करते हैं थोड़ा सा. करें? बता दो. Caused by? बिल्कुल. Patient will have clinical features of which type of fever is classically seen? Step ladder fever. आहिस्ता आहिस्ता जा रहा है ऊपर. Swinging fever is a feature of. Swinging fever is a feature of. Swinging fever is a swinging fever is a feature of. Very good, excellent. Brucellosis. ठीक है? Then, what are the investigations? Basu, B for A for agglutination test or Vidal test. S for stool culture. U for urine culture. ठीक है? उसके बाद there is a classical type of diarrhea seen in typhoid. Pea soup diarrhea. कौन सा diarrhea दिखता है? Pea soup diarrhea. And which fever? Strep bladder fever. What is the treatment? Ceftriaxone for carriers and prophylaxis. Rifampicin. What is the treatment? Rifampicin. Is that clear? Yes. So remember, step ladder fever, Basu se question aata hai. From typhoid, you will get the question from where? Basu. They will give a 2 weeks history and what is the next step? So what is the test? 2 weeks at Vidal. ठीक है ना? So BASU. ठीक है? HIV, you already know everything. ठीक है ना? HIV में tests we discuss, opportunistic infection we discuss, treatment we discussed. Okay? Then rabies, everything, malaria, everything. Chalo. Iceberg phenomena. These are all the visible cases that can be detected or that are already diagnosed. These are the hidden cases which are ignored deliberately, asymptomatic, latent, or pre-symptomatic. What is the surrounding water? You and me, healthy population. Okay. And this line, demarcation line between apparent and non-apparent cases. Is that clear? Okay. Now, disease showing this phenomena, sir, or the submerged part, HIV, malaria, typhoid, cholera, polio, and diphtheria. This is going to be your disease showing the phenomena. Not showing. That are no hidden cases. मतलब जो visible है. Rabies, tetanus, pertussis, measles. Is that clear? Yes. So that is your which phenomena? Iceberg phenomena. ये हो गया submerged part. ठीक है? ये हो गया visible part. Done? Depending full question दिखाना with options depending है ना disease कौन सा ये. Ping me on the telegram. CBR of a population is 19 and CDR is given in 6. Find an annual growth rate. Your FMG recall question. Sir, that is CBR minus divided by 10. कर दो. 19 minus 16 divided by 10. कितना हो गया? 1.3. What is the answer? 1.3. Okay, what is the formula for the annual growth? CBR minus CDR divided by and what is the answer? 1.3%. 1.3%. चलो अब ये क्वेश्चन कर दो. I will see. चलो कर दो. यही करते हो तुम लोग। ये पता है मुझे, गलती करने वाले थे। बताओ एज क्या है पेशेंट की? चलो अब करो, चलो अब तो जिंक होगा ही नहीं। व्हाट इज द आंसर? देख लो अच्छे से। बता दो डायग्नोसिस। हाँ हाँ हाँ, लाउडली। वेरी गुड। डायग्नोसिस इज फ्राइनोडर्मा। है सही तो बता रहा है, यहां से देखा। ठीक है। फ्राइनोडर्मा is caused by due to the deficiency of essential fatty acids. So question is saying, question is saying that, question is saying that, see, a 42-year-old man with a small bowel fistula receiving a TPN with standard hypertonic glucose amino acid. The patient noticed scaly hyperpigment lesion over the acral surfaces of the elbow and knees. ठीक है, समझ आ गया? सिमिलर टू एंटेरोपैथिक एक्रोडर्मेटाइटिस। ये थोड़ी बोल रहा है कि एक्रोडर्मेटाइटिस एंटेरोपैथिक का है। सिमिलर। पहली बात, इन द मॉर्निंग ओनली आई टोल्ड यू एक्रोडर्मेटाइटिस इन इन्फेंट्स। ये तो बुढ़ा है, 42-year-old. What is the most cause of the condition? So it's going to be essential fatty acid. यहां पे भी तो इमेज दी थी। What is the condition called as? Prinoderma, or it's also called as which like skin? Toad like skin. So patient is having toad like skin. Which other condition have scaly lesions on the extensors? Dermatitis herpetiformis. कहां पे मिलता है? Again, associated with celiac disease. Drug of choice is Dapsone. Bro, avoid. दे दो क्या? राइस, पोहा, बार्ले? नहीं देंगे तो क्या देंगे बताओ? What are the foods avoid in dermatitis herpetiformis? चलो। हाँ, वीट। और देंगे क्या? हाँ, वीट दे सकते हैं। ठीक है ना? चलो, बार्ले राई ओट स्वीट अवॉइड से लिख दिया ब्रो। चलो लेट मी मैं सब कुछ बताऊंगा। सीलियक भी बताऊंगा, डेप्सोन भी बताऊंगा, डर्मेटाइट्स भी बताऊंगा, सब कुछ बताऊंगा। चलो लेट्स राइट फर्स्ट, हाउ मेनी एसेंशियल फैटी एसिड्स वी हैव? मेनली बहुत है तो मेनली लिखो। लीनो essential fatty acids. Essential fatty acid. Okay. So essential fatty acids में what is the first thing you will write? So we have linoleic, we have linolenic, and we have DHA. Linoleic, linolenic, and DHA. Linoleic, what is a richest source? Safflower oil. Linolenic, we have flaxseed oil. DHA, we have breast milk. And this DHA helps in brain development. Is that clear? And the deficiency have a toad-like skin or thick, dry skin will be mentioned. Thick, dry skin. So that is going to be your rhinoderma. Rhinoderma. Then same condition we have also what? Dermatitis. Herpetiformis. What are the two antibodies? Endomysial antibody and TTG. Is that clear? Yes, celiac disease में होती है। Dermatitis नहीं लिखना। Celiac disease. What is the drug of choice for dermatitis herpetiformis, dapsone. And sir, इसके लिए treatment of choice क्या दोगे? Gluten free diet. What is the thing? Gluten free diet. Then avoid bro. ठीक है? Yes? Clear? चलो. Can you tell me what is the HLA associated with celiac disease? DQ2 or HLA-B8. Psoriasis, HLA-CW6. Ankylosing spondylitis, B27. Reactive arthritis, B27. IBD, B27. Anterior uveitis, B27. Psoriatic arthritis, B27. ठीक है? Done? चलो. All of the following constitutes demographic process except. Yes, what's the answer? Morbidity. What's the answer? Morbidity. Chalo. We have a 5 demographic processes. Okay, what is demography? Study of population. ठीक है ना? Write it down. We have mortality. We have marriage. We have fertility. We have migration. We have social mobility. We have social mobility. Is that clear? Yes. So now indicators of demography. First of all, we have crude birth rate. What is crude birth rate? Number of live births upon mid-year population multiplied by 1. Mid-year population was calculated on or is calculated on 1st July. Again a PYQ. What is crude death rate? Number of deaths 1000. General fertility rate. Total number of live births. Total number of live births upon mid-year population of an age group between 15 to 45. ठीक है ना? Multiplied by 1000. General marital fertility rate. Total number of live births but married people. Total number of live births upon total mid-year population, or just write, or mid-year population of married 15 to 45 of age group. Okay? Then we have total fertility rate, number of live children born to a woman in her entire reproductive period, TFR. If G for gross, G for girl, so total number of girl children born to alive to a lady in her entire reproductive period. Then we have NRR, net reproductive rate, total number of girl children remaining alive till her own reproduction. Okay? That is called a net R, NRR. The most important demographic vital is NRR, and the only one which includes mortality, NRR. ठीक है ना? NRR. Is that clear? ठीक है? चलो, next. The Alma Ata Conference 1978 was conducted with the theme to discuss on the primary and essential healthcare. All of the following are the principles except. All of the following are the principles except. Yes, appropriate policy. The answer is appropriate technology. असल में क्या है? Appropriate technology. But the answer is here appropriate policy. Sometimes they will say inappropriate technology. वो भी answer हो सकता है. Sometimes they will write appropriate policy. Is that clear? So let's write elements and the principles of healthcare. Principles of healthcare बता दो पहले. Loudly. Equitable distribution. Second one. Community participation. Third one. Intersectional coordination. Fourth one. Appropriate technology. Appropriate technology. Is that clear? Is that clear? Sure. Now elements. E for education. So which education बच्चों? Health education. ठीक है? Then L, locally endemic disease. Then E, essential drugs. Then M, mother and child care. Then E, that's I, immunization. Then N, nutrition. Then T, treatment of common disease. And S is going to be safe water supply and sanitation. And sanitation. क्या हो गया? Safe water supply and sanitation. Safe water supply and sanitation. Right, sanitation. हाँ? क्यों? Sanitation. Safe water break. थक गए? ले लो 5 मिनट. Last 20